Hi everybody. Today we are going to discuss about preventive orthodontics. Preventive orthodontics is the action taken to preserve the integrity of what appears to be normal occlusion at specific time. Preventive and interceptive orthodontics have many procedures in common, but the timings are different. The preventive procedures are undertaken in anticipation of development of a problem. When we think there is going to be a problem, then we do preventive procedures. Whereas the interceptive procedures are undertaken when the problem has already manifested. What are the benefits or advantages of preventive orthodontics? Number one, intervening in deciduous dentition will simplify the treatment in permanent dentition. Number two is better compliance is possible at younger age. Number three, the better stability of the treatment. Number four, the better use of growth to aid treatment. Number five is pathologies like a root resorption may be avoided. It's possible to avoid orthodontic surgery at a later age. Improved aesthetics due to early intervention. It is possible to avoid psychosocial problems associated with malocclusion. But on the other hand, what are the disadvantages or what are the drawbacks? Earlier the treatment begins, the longer it will last. The lengthy treatment plans can result in cooperation, burnout, caries, increased cost of treatment and root resorption. Next is sometimes growth prediction is unreliable at early age. And the last is there are chances of relapse. Now we will see what are the preventive orthodontic procedures. Number one is parent education. Number two, caries control. Number three, care of deciduous dentition. Number four, management of ankylosed teeth. Number five, maintenance of quadrant-wise tooth shedding timetable. Number six, check for oral habits and intervention if required. Number seven, the occlusal equilibration if there are any occlusal prematurities. Number 8 is prevention of damage to occlusion. Number 9, extraction of supernumerary teeth. Number 10, the space maintenance. Number 11, the management of deeply locked first permanent molars. And number 12 is the management of abnormal frenal attachments. So we are going to study each of these in detail. So number one is parent education. What do we do in the parent education? Is the parent should be educated on the need for maintaining good oral hygiene. They should be taught the correct method of brushing the child's teeth. Number two is caries control. The caries control, caries involving the proximal surfaces of deciduous teeth, if not restored, leads to loss of arch length by movement of adjacent teeth into the space, resulting in discrepancy between the arch length and the tooth material when the permanent teeth erupt into the oral cavity. Number three is care of deciduous dentition. The deciduous teeth are excellent natural space maintainers. They are the best space maintainers until the developing permanent teeth are ready to erupt into the oral cavity. Therefore, all efforts should be taken to prevent early loss of the deciduous teeth by simple preventive procedures. Remember, therefore, all efforts should be taken to prevent early loss of the deciduous teeth by simple preventive procedures such as application of fluoride and pit and fissure sealants to prevent caries. Number 4, extraction of supernumerary teeth. The supernumerary teeth are extra teeth that are present in addition to the normal complement of teeth. They are more common in permanent dentition than the deciduous dentition. Common in males than in females, common in maxilla than mandible. The presence of supernumerary teeth and or supplemental teeth can cause crowding or can deflect adjacent teeth to erupt in abnormal position. Thus, supernumerary teeth should be identified and extracted before they cause crowding or spacing or displacement of other teeth. Number 5 is eliminating the occlusal interferences. All functional prematurities should be eliminated as they can lead to deviations in the mandibular path of closure and also predispose to bruxism. Abnormal anatomical features like enamel pearl and large cingulum on maxillary incisors are detected and selective grinding is done at the earliest. Next is maintenance of tooth shedding timetable. There should not be more than 3 to 6 months difference in shedding deciduous teeth and eruption of permanent teeth. Delay in eruption may be due to one of the following reasons. It could be because of presence of over-retained deciduous teeth roots, presence of unresorbed deciduous root fragments, supernumerary tooth, cyst and tumors, overhanging restorations in the deciduous teeth, fibrosis of gingiva, ankylosed primary teeth. So, the delay in eruption caused by presence of supernumerary teeth or unresorbed root fragments often improve once the cause is removed. The over-retained deciduous teeth sometimes lead to ectopic eruption of the permanent successor. So, extraction of the deciduous teeth is indicated to allow the permanent teeth to move into ideal position. The second deciduous molars are often over-retained due to congenital absence of second premolars. Next is management of ankylosed tooth. How do you manage the ankylosed tooth? The ankylosis is a condition characterized by absence of periodontal membrane on root surface area. The ankylosis can occur as a result of congenital absence of permanent successor, failure of resorption of the deciduous tooth, or trauma to the tooth, or as a result of infection. So, ankylosed deciduous teeth do not get resorbed and therefore either prevent the permanent teeth from erupting or deflect them to erupt in abnormal locations. Ankylosed tooth are usually submerged and can cause tipping of adjacent teeth and possibly supra-eruption of the opposing tooth. These ankylosed teeth should be diagnosed and the decision should be made either to surgically remove at an appropriate time to permit the permanent teeth to erupt or build up the vertical dimension of the tooth and retain it. Next is management of abnormal frenal attachments. The presence of thick and fleshy labial frenum that is attached relatively low prevents the maxillary central incisors from approximating each other, producing midline diastema. They should be diagnosed by Blanch test and treated by surgical excision. Next is ankyloglossia or tongue tie. It results from the lingual frenum extending further than usual towards the tip of the tongue. This limits the forward mobility of the tongue, so it should be surgically treated. Next is oral habits and its intervention. The habits such as finger and thumb sucking, nail biting, tongue thrusting and lip biting should be identified and stopped at an early age. The habits itself is another chapter. So, we are going to discuss about all these habits in detail in another chapter. Then comes the management of deeply locked permanent first molars. The deciduous second molars occasionally have a prominent distal bulge preventing the eruption of the first permanent molars. So, the slicing of the distal surface of the deciduous second molar helps in guiding the eruption of the first permanent molars. Next is the space maintenance or space maintainers. The space maintainer is a device used to maintain the space created by the loss of deciduous tooth. What are the ideal requirements of the space maintainer? It should maintain the entire mesiodistal space created by a lost tooth. It must restore the function as far as possible and prevent over eruption of the opposing tooth. It should be simple in construction. It should be strong enough to withstand the functional forces. It should not exert excessive stress on adjacent teeth. It must permit maintenance of oral hygiene. It must not restrict normal growth and development during transition from deciduous to permanent dentition. The space maintainer should not come in the way of other functions. Space maintainers can be removable space maintainers or fixed space maintainers. The removable space maintainers are the space maintainers that can be removed and reinserted into the oral cavity by the patient. It can be classified as functional or non-functional. The functional space maintainers incorporate teeth to aid in mastication, speech, and aesthetics. The non-functional space maintainers have only an acrylic extension over the edentulous area to prevent space closure. The commonly used removable space maintainers are acrylic partial dentures and removable distal shoe space maintainer. Now, what are the indications and contraindications of the space maintainers? The indications. The removable dentures are indicated when aesthetics is of importance. In case the abutment teeth cannot support a fixed appliance, then it is recommended to use a removable space maintainer. In cleft patients who require obturator, in case the radiograph reveals that the unerupted permanent tooth is not going to erupt in less than 5 months' time, a removable space maintainer can be given. If the permanent teeth have not fully erupted, it may be difficult to adapt the bands. Thus, it is advisable to use removable space maintainers. The multiple missing deciduous teeth that may require functional replacement in the form of partial dentures. These are the indications for space maintenance, removable space maintenance. What are the contraindications? The contraindications can be the lack of patient cooperation in patients who are allergic to acrylic materials, the patients who are epileptic, that is, epileptic patients who have uncontrolled seizures cannot use or should not be using the removable space maintainers. What are the advantages and disadvantages of space maintainers? The removable space maintainers. The advantage is they are easy to clean and permit maintenance of proper oral hygiene. They maintain or restore the vertical dimension. They serve other important functions like mastication, aesthetics, and phonetics. The dental checkup for caries detection can be undertaken easily. There is a room can be made for the permanent teeth to erupt without changing the appliance. They stimulate the eruption of permanent teeth. Dental checkup for caries detection can be undertaken easily. Room can be made for the permanent teeth to erupt without changing the appliance. They stimulate the eruption of permanent teeth. The band construction is not necessary. They prevent development of tongue thrust habit into the extraction space. Means the tongue thrust habit will be avoided. Now we will study about the disadvantages. They may be lost or broken by the patient. The uncooperative patients may not wear the appliance. The lateral jaw growth may be restricted if clasps are are not incorporated. They may cause irritation of the underlying soft tissue. These are the advantages and disadvantages of removable space maintenance. Now we will study about the fixed space maintenance. The space maintenance that are fixed or fitted onto the teeth are called fixed space maintenance. The examples of fixed space maintenance are band and loop space maintainer, crown and loop appliance, the lingual arch space maintainer, the palatal arch appliance, the transpalatal arch, so called TPA, the distal shoe space maintainer, the aesthetic anterior space maintainers, the band and bar type space maintainer, pre-found bonded space maintainers. Now we'll study about the advantages and disadvantages of fixed space maintenance. The advantages are band and crowns are used which require minimum or no tooth preparation. They do not interfere with passive eruption of abutment teeth. Jaw growth is not hampered. The permanent teeth are free to erupt into the oral cavity. They can be used in uncooperative patients. The masticatory function is restored if pontics are placed. Now, what are the disadvantages of the fixed space maintenance? Number one is elaborate instrumentation with expert skill is needed. They may result in decalcification of tooth material under the bands. Supra-eruption of opposing teeth can take place if pontics are not used. If pontics are used, it can interfere with vertical eruption of replacing permanent teeth if the patient fails to report. Of all these, we study about distal shoe space maintainer. It is an intra-alveolar appliance. When the second primary molar is removed prior to the eruption of the first permanent molar, the intra-alveolar appliance provides greater control of the path of eruption of the unerupted tooth and prevent undesirable mesial migration of the molar. What are the indications of distal shoe space maintainer? Number one is the premature loss or extraction of E, that is deciduous second molar, prior to eruption of 6, that is permanent first molar. Number two is advanced root resorption and periapical bone destruction of the deciduous second molar prior to the eruption of the permanent molar. E with advanced caries that is not restorable, that is the second deciduous molar with advanced caries that is not restorable, ectopic eruption of the first permanent molar and ankylosis of the second deciduous molar. The contraindications are inadequate abutments due to multiple loss of teeth, poor patient or parental cooperation, missing permanent first molar, systemic diseases that affect healing such as diabetes mellitus, then cardiac anomalies that require antibiotic prophylaxis prior to dental treatment. These are the contraindications of distal shoe space maintainer. Planning for space maintainer. The following are the factors that should be considered when space maintenance is planned. First is the time elapsed since the loss of tooth. It is advisable to place a space maintainer as soon as the primary teeth are removed because the maximum loss of space occurs within the 6 months of extraction of teeth. Next is the dental age of the patient. The dental age of the patient should always be considered than the chronological age because too much variation in eruption of teeth is observed. Next is the thickness of bone covering the unerupted teeth. The more the bone covering the unerupted tooth, the more would be the time it would take to erupt. Therefore, space maintainer is indicated. Next is the sequence of eruption of teeth. Whenever a space maintainer is planned, adequate consideration should be given to the adjacent developing and erupting teeth. The congenital absence of permanent teeth. In such cases, we have to decide whether to retain the space until a replacement is made or the other erupting teeth to drift and close the space. So these are the topics that we covered under the preventive orthodontics. Different types of space maintainers and the removable and fixed space maintainers, planning for space maintainer, and what are the preventive procedures that we undertake. Keep watching these videos on YouTube and please subscribe to my channel for further updates about orthodontics and orthodontic classes.